3:06 Thursday afternoon. Thanks for spending the day with us here on the Mighty 790 KFGO and the Dan Hammer Show. March is Colorectal Cancer Awareness Month. We are joined by Dr. Erik Fetner of Sanford. Dr. Fetner, thank you for coming in today.
My pleasure.
Since it is Awareness Month, Colorectal Cancer Awareness Month, give us a little 101 on the disease.
Well, colon cancer is a cancer of the colon, the large intestine. The colorectal cancer divided into two categories because we treat rectal cancer a little differently than colon cancer just because of its anatomic location. But it's basically the same disease. It's a disease that comes from abnormal growth of the lining of the colon. And because of that, it is a disease that we can actually prevent and treat. And that's part of why we have Colorectal Cancer Awareness Month, because we want to talk specifically in some point today about screening, about a way to prevent it. But generally, it's just cancer of the colon. It's a disease that affects about 150,000 Americans a year. About a third of that number will ultimately die from it with historical numbers. So it's an important disease. It's the second leading cause of cancer deaths in America, behind lung cancer, ahead of both prostate and breast cancer. So it's a major force in disease. But fortunately, it's a disease we can treat very effectively and cure, and one that we can prevent. And we'll talk about that in a second, too.
Screening, so important. And I know it's a theme that is repeated so often, but can't be repeated enough when you talk about colorectal cancer, and that's the screening part of it, the very front end of it. At what age should people begin to be screened, and how often should they be screened these days?
Sure, important topic. Screening for colorectal cancer is designed to identify people that are at risk of the disease and identify the disease in early stages. Fortunately, colorectal cancer is actually a slow-growing process, and the vast majority of colorectal cancers arise out of polyps. So we have these abnormal growths inside the lining of our colon that aren't initially cancer, but develop into a cancer. When those are treated, when they're removed, they actually can't grow further than that stage. And so screening is a means to identify those early and remove them, or a colonoscopy is. So we recommend that the average risk person in the society get screened starting at age 50. That's people without any family history, without any symptoms. So basically everybody starting at 50 that are Northern European and Caucasian. American Indian and African Americans, we recommend start at 45, so a few years earlier because of their increased risk. And then anybody with a family history should talk to their primary physician and potentially get screened earlier.
Family history of any type of cancer?
Family history of colorectal cancer or severe polyps.
Okay.
Sure.
There's sometimes a stigma, I think, with the screening process. It's not that bad. I'm speaking from experience, in my opinion, anyway.
No, sure, absolutely. I can tell you, universally, the person that's done it the first time has anxiety about it. They're fearful, they're giggly. It's something we don't like to talk about or discuss. Nobody that's had a second colonoscopy fears having it. It's always the process and, sort of the stigma that is something that's uncomfortable or that's just, squeamish. But people tolerate it extremely well. It's a test that's done, you come in, you go home an hour later, and it really can be a lifesaver. I mean, I can't emphasize enough. Screening tests that we do for prostate cancer, for breast cancer, for various types of cancer can identify a cancer early, but they can't actually prevent it. Colon cancer screening, and particularly colonoscopy with its removal of polyps, is a modality that literally not only can save lives, but can prevent the cancer from ever occurring. And that's been proven. And we know in populations that get screened, they have fewer cancers. And I can't emphasize enough how important it is that people come in to get screened. The CDC says that about 40% of the population that needs to be screened isn't getting screened every year. So that's a
big number. That's too big of a number.
Way too big of a number, right? There really isn't any reason that we can't screen everybody. But it's a huge number that isn't getting screened, and that correlates to a huge number of people that get a disease and a cancer that they really shouldn't get.
So someone decides to be screened. Now they're going to get their colonoscopy. What should they expect from the colonoscopy? What will happen?
Sure. So to get a colonoscopy, you need to have your colon cleaned out, right? And so part of the process for a colonoscopy is a prep. That usually starts the day before, so we'll limit your high fiber intake the day before the procedure, and you'll get various preps. There's some that are liquid preps that you drink. There are some pills that you can take to help kind of flush out your colon. But fundamentally, you just need to clean it out. That happens the evening before the procedure. You don't eat anything the night before you show up the next morning. You get an IV. You get some medicines in the IV that make you sleepy. You wake up and wonder when your colonoscopy is going to get done. and it,
That was the case for me.
That happens fairly often. I bet you 50% of the time patients will wake up and say, when are we going to get started? And I'm going to say, well, we're already done. And so the worst part of it is usually kind of the prep, which is just drinking some stuff the night before and flushing yourself clean.
There you go. Any risk factors involved when you heading into your colonoscopy?
Well, there are risks. It's a procedure. It's an invasive procedure, but they're extremely rare. So we're taking a tube and advancing it in and around the colon. Two major risks or two major complications can occur from that procedure. One is that we create a hole in the colon, and that's when it's done is almost always in the setting of some other disease, either a large polyp or some colonic disease that predicates the colon to injury, colitis or some weakening of the colon wall. But that's an extremely rare occurrence, well under 1 in 10,000 issues. The other is bleeding from removing a polyp. That happens a little more frequently, often doesn't require any further intervention. But those are the two big risk factors. But in all honesty, with the modern preps, with the modern anesthetic, and with the modern tools, the colonoscopy, the flexible colonoscopy, the high def, it's very rare to have that complication.
We're visiting with Sanford's Dr. Erik Fetner. March is Colorectal Cancer Awareness Month. Do you mind taking a phone call here? We did have someone call in who doesn't mind.
Oh, sure.
If you don't mind taking a question here from this caller. And just put those on, Doctor, and you'll be able to answer the question. Go ahead, Dan.
Hey, good afternoon, Doctor.
Hello.
I've had two brothers in their mid-50s die of colon cancer. I have had 3 of the procedures done. They have found polyps on every time they've gone in, but they've been benign. My question was, the doctor told me, Dan, I don't think I need to see you in 5 years from now. I think that's too long. I was going to get your point of view.
Sure. Well, I mean, we base those recommendations on screening guidelines that we figure out from large studies of large patients that have similar types of problems. The guidelines are fairly clear and confirm what that doctor said. So 5 years is not an unreasonably long period of time. I mean, you're at an increased risk because you have a family history. And if you had benign polyps in the past, you're at an increased risk. Realistically, though, the type of cancer that develops in the colon is a slow-growing process. So you can't, you can overdo it, right? It would be unreasonable to get a colonoscopy every week, right? That would guarantee that you never got a colon cancer because we'd look every week and make sure nothing ever grew. But realistically, that's not an appropriate recommendation, right? And it's some time between every week and and never again is the right amount of time. What we know from statistics and what we know from large pools of people that there's a huge window of safety in waiting 5 years for you. If you had any symptoms, any changes, any indication to do it sooner, then I'd opt on the side of doing it sooner than 5 years. But that's the standard guideline. So with an increased risk and no significant reason to have it sooner, 5 years is the appropriate interval for you.
All right.
Thank you, Dan.
Thank you. Well, thank you.
Thank you, Dan. You talk about symptoms or signs.
Sure.
What are they?
Well, colorectal cancer is a growth inside the colon, and that can create several problems, the most common of which are blood in the stools or bleeding. Sometimes that's visible blood that a patient could actually see. Sometimes it's stool or blood in the stool that can only be found by testing. That's an early sign of that. Bowel habit changes are a significant problem. So change in caliber of your stools, change in frequency of your stools, change in consistency of the stools that occurs. Abdominal pains, complete or a feeling of incomplete evacuation can be a symptom that warrants further workup. But mostly blood in the stools or change in bowel habits, unexplained weight loss can be an indication of it. But essentially those.
And is there anything one can do to prevent getting colon or colorectal cancer?
Well, a lot of it has to do with just what we're doomed as humans to get. We do know, however, that sedentary lifestyle, so stay active, stay exercise, avoiding high fat, low fiber diets over a lifetime can affect our overall risk of cancers. But specifically, no. The best thing you can do, the best thing the average person and listener of the radio program can do is get screened appropriately. Like we talked about earlier in the program, we literally can save you or prevent you from getting a colon cancer by identifying polyps early. And so really, get seen by your doctor every year and do what they tell you. And one of the things they should tell you to do starting at 50 is to get your colon looked at.
Get screened.
Get
screened.
Right.
Believe me, I was one of those at one time when it came time for me to be screened. Was a little bit nervous going in, but believe me, you might have some nervous butterflies, but you'll be rid of them in a hurry, and you'll feel much better coming out of it that you did get initially screened.
Well worth it. It's
Yes.
well worth it.
Dr. Erik Fetner from Sanford. Thank you, sir.
My pleasure, Dan.
Appreciate
Thank
it.
you.